My clinical hypothesis for this year, because of my new learning in arteries and fascia, is that a neurovascular fascial approach can guide new impairment assessments and treatments for people following breast cancer treatments. There's 3 underlying beliefs for this hypothesis. The first is that there is that extremely close connection between the arteries, the veins, and the nerves, so they're right next to each other. The second is that, and this comes from Kieran Shoemaker and also from my long experience, is that the body can harbor tightnesses from old injuries, and tightnesses within these 3 things, the arteries, veins, and nerves, or in fact 4 things, arteries, veins, nerves to the muscle, and that this tightness can stay for months, years, and decades. The third thing is that we're looking at a completely different method of gaining stretch and relax when we're talking about arteries. What I found was that 60% of the blood that goes to the breast comes from the middle of the body. So let's have a look at that. So this artery is called the internal thoracic artery. It comes off the large artery that comes off the heart. We can't see the heart in this instance. And it drops down underneath the sternum to the side of the sternum. And from there, it sends off smaller arteries that go wrapping around within the muscle that goes between each of the ribs. And then it has these perforating arteries that pierce through the tissue and come out to the pectoral muscles, which then goes onto the breast and then into the skin. So this vascular system, arteries and veins, is really quite complex. Nothing like what I learned at university and in the years after looking at the textbooks. They were just single line, single red line, single blue line. But what they are is a way more connected system, and that the system that they're connected by is the fascial system, and it just doesn't sit on the top of these structures. They go into the muscles, they perforate muscles. This system is an elastic system, but it can be compressed by some structures that might be too tight. They can also be prone to overstretching. They can be prone to systematic inflammation, and they are part of the whole body biotensegrity. This research is specific to breast cancer. It's 2016, and it's for women that are 15 years post radiotherapy. What they found specifically was that the changes in the stiffness of the artery was specific to the side that radiotherapy was received. So for example, the people that received radiotherapy on the left side, they had changes in the artery, on the carotid artery and the brachial, which is the arm arteries. They had changes on the left side, not the right side. That I had to add in additional impairment tests. And those tests were based on the location that I was interested in. And so I'm now using head and shoulder turning. I'm using side bend, and I'm using forward bend. I'm also using a palpation of tension within the structures where the arteries run. And so they're all different to how I was practicing before this year. My treatments changed. And so when I'm interested in gaining tense artery release or a stiff artery release, then I'm looking at doing that in the muscles beside the spine, the erector spinae. I'm looking at the intercostal area, so that the space between the ribs. I'm looking at the sternum, the diaphragm, the neck, And of course, I'm looking at artery release in the breast tissue.